Hey everyone! Today we're diving into a very important topic, the symptoms of cervical cancer that women should never ignore. Early detection can save lives, so let's get informed. We're going to talk about what cervical cancer is, why it's so important to catch it early, and most importantly, the warning signs you should never ignore. This video is meant to be informative and empowering, not to scare you. Remember, knowledge is power, and understanding the signs and symptoms of cervical cancer can make a world of difference. First and foremost, let's talk about unusual vaginal bleeding. This is a topic that can be quite concerning for many women, but it's important to address it openly and honestly. Now, I know what you're thinking, Dr. Mike. Isn't bleeding normal? And yes, you're right to an extent. We all know that menstrual cycles are a natural part of life. However, it's crucial to understand the difference between normal menstrual bleeding and something that might be a cause for concern. But what we're talking about here is bleeding that falls outside of your normal cycle. This could be spotting, heavy bleeding, or anything that deviates from your usual pattern. This could mean bleeding between periods, bleeding after sexual intercourse, or even bleeding after menopause. Each of these scenarios can be alarming and should not be ignored. Bleeding after menopause in particular is something that should be promptly evaluated by a healthcare provider. Any bleeding that's out of the ordinary should be a red flag, and you should get it checked out by your doctor. It's always better to be safe than sorry. Now, I'm not saying that every instance of unusual bleeding means you have cervical cancer. There are many other, less serious reasons why this might happen, such as hormonal imbalances or benign growths. But it's always better to err on the side of caution. Early detection and treatment can make a significant difference in outcomes. Think of it like this. Your body is constantly communicating with you, and sometimes it speaks in whispers. These whispers can be subtle signs that something is amiss. Unusual bleeding could be one of those whispers. It's your body's way of saying, hey, something's not quite right down here. Can you take a look? Don't ignore those whispers. They are important signals that deserve your attention. It's your body's way of saying, hey, something's not quite right down here. Can you take a look? Don't ignore those whispers. Listen to your body and get checked out by a professional. Your health is worth it. Next up, we have pelvic pain. This is a common issue that many women face at some point in their lives, and it can be both physically and emotionally draining. Again, this is a symptom that can be caused by a variety of factors, some more serious than others. It could be due to something as simple as a urinary tract infection or as complex as endometriosis. But when it comes to cervical cancer, persistent pelvic pain is definitely something you don't want to ignore. This type of pain can be a red flag that warrants immediate medical attention. We're not talking about the occasional cramp or twinge here. Those are usually harmless and often related to your menstrual cycle or digestive issues. We're talking about pain that's constant, pain that's severe, or pain that just doesn't seem to go away. This kind of pain can interfere with your daily activities and overall quality of life. And here's the thing. Pelvic pain related to cervical cancer often isn't related to your menstrual cycle. It can occur at any time and is usually more intense and persistent. So, if you're experiencing pain outside of your period, or if the pain is different from your usual menstrual cramps, that's a sign that something else might be going on. It's crucial to pay attention to these changes in your body. I know it can be uncomfortable to talk about these things, but trust me, it's important. Open communication with your healthcare provider can lead to early diagnosis and better outcomes. Your health is your most valuable asset, and you deserve to feel your best. Don't hesitate to seek help and take charge of your well-being. Now, this next symptom can be a little bit more sensitive to talk about, but it's crucial that we address it openly and honestly. We're talking about pain during intercourse. I know this can be an uncomfortable topic, but it's so important for women to feel empowered to speak up about their sexual health and well-being. Pain during sex is not normal. It's not something you should just put up with or ignore. If you're experiencing pain, it's your body's way of telling you that something's not right. It's a signal that shouldn't be overlooked. And while there are many potential causes of painful intercourse, ranging from infections to hormonal changes, cervical cancer is one of them. This is why it's so important to pay attention to your body and seek medical advice. So, if you're experiencing this symptom, please don't brush it off or feel embarrassed. Talk to your doctor. There's no shame in seeking help for your sexual health. In fact, it's a proactive step towards better health. In fact, it's a sign of strength and self-care. Taking charge of your health is one of the most empowering things you can do for yourself. Chapter 4. Unusual vaginal discharge. Let's move on to another symptom that can be a bit tricky: unusual vaginal discharge. Now, it's perfectly normal to have some vaginal discharge. It's your body's way of keeping things clean and healthy down there. But what we're talking about here is discharge that's different from your usual. This could mean a change in color, consistency, or odor. For example, discharge that's watery, bloody, or has a foul odor could be a sign of cervical cancer. Again, it's important to remember that these changes could be caused by other factors as well, but it's always better to be safe than sorry. If you notice any changes in your discharge, make an appointment with your doctor to get checked out. Chapter 5. Painful urination. Next, let's talk about a symptom that can be a real pain, literally painful urination. We've all experienced that burning sensation when we have a urinary tract infection, but pain or discomfort while urinating can also be a sign of something more serious, like cervical cancer. If you're experiencing pain or burning every time you pee, or if you notice any blood in your urine, it's essential to see your doctor right away. These symptoms could indicate that the cancer has spread to nearby organs, like your bladder. Early detection is key when it comes to treating cervical cancer effectively, so don't delay seeking medical attention. Chapter 6. Frequent urination. Now, this next symptom might seem a little bit strange, but it's important to be aware of frequent urination. We all have to go to the bathroom every now and then, but if you find yourself needing to urinate more often than usual, especially at night, it could be a sign of cervical cancer. This is because as the tumor grows, it can press on your bladder, making you feel like you constantly need to pee. Of course, there are many other reasons why you might be experiencing frequent urination, like drinking too much fluid or certain medications. But if the urge is persistent and interfering with your daily life, it's worth getting checked out by a doctor. Chapter 7. Unexplained weight loss. Let's talk about a symptom that can be a bit of a double-edged sword: unexplained weight loss. I know, we all want to lose a few pounds here and there, but losing weight without trying is never a good sign. In fact, it can be a symptom of many cancers, including cervical cancer. This is because cancer cells are greedy little things. They use up a lot of your body's energy, which can lead to weight loss. So if you've been losing weight without making any changes to your diet or exercise routine, it's important to see your doctor to rule out any underlying medical conditions. Chapter 8. Fatigue. Let's talk about a symptom that can really take a toll on your quality of life: fatigue. We all feel tired from time to time, but fatigue is different. It's that feeling of being constantly exhausted, even after a good night's sleep. If you're feeling extremely tired all the time, even after resting, it could be a sign of cervical cancer. This is because, as we mentioned earlier, cancer cells use up a lot of your body's energy. So if you're experiencing persistent fatigue that's interfering with your daily activities, don't ignore it. Talk to your doctor. Thanks for watching. And remember, if you or someone you know is experiencing any of these symptoms, it's crucial to see a healthcare provider as soon as possible. Early detection is key. Cervical cancer is a serious disease, but it's often treatable when caught early. Don't be afraid to advocate for your health and ask your doctor any questions you may have. Stay healthy and stay informed.